Or at least the heat off.
I turned it off.
Okay.
She's got a little bit of a cataract formation, not too bad though.
Okay.
99.8. Oh, you can see her little rosettes. Yeah. Oh, she's got some tough leopard fur here.
One-year-old leopards have really sharp teeth,
Yeah.
even though they're old and they hurt. Remember that at home, kids.
This is dilute baby shampoo and dilute betadine solution. They're safer on the eye.
Oh,
You
okay.
never want to put scrub around the eye because it burns. Well, taking this eye out anyhow, but I always think about saving eyes first.
So part of the drugs that we used to actually knock the black leopard out, now that she's safely unconscious, we can reverse those because she's on gas here in our hospital, so we can reverse the initial sedation agent, and that'll be much healthier for her in the long run. So now she's on gas, we can do that.
All right, Liz, can I cut her?
Yeah, go ahead. Scott, now's
She's got
when we're
tough
going to
skin.
watch to see if her respiratory rate changes.
I got no response up here.
Okay.
In case she's not bleeding yet, so in case she starts to bleed once I go back here, I'm going to cut this her optic nerve last. I packed gel foam in there and helps stop the bleeding.
Does it stay?
It stays, yeah, it'll stay.
So basically the surgery has been a success. We've got her eyeball out, and actually we'll ask Dr. Miller why we took out the eyeball, why it was more important to have that gone than leave it in there and try to treat it. Dr. Miller.
So she appears to have had chronic uveitis of some kind, so we need to try to identify an underlying cause if possible. And because of the chronic uveitis, it loosened her lens, and her lens actually luxated because of it. And it luxated into her anterior chamber, where it was causing her a great deal of discomfort. And so now that we've removed that, she should be markedly more comfortable after this.
Okay, so basically what that means and stuff that we can all understand is her eyeball was really hurting her, and there's nothing that we can do to fix it right now. So due to Bagheera's age and just the fact that she's a leopard that lives outside, our best case is to remove this eye. She's going to feel better when she wakes up today because that irritant's going to be gone. She couldn't see out of it anyways, so it's going to be a much better situation for her. And at 20 years old, we want to make her as comfortable as possible.
We are a few months later with Bagheera. She had her eye removed because of glaucoma. In her case, we had to remove her eye because of the pain associated with her glaucoma. If she were a normal domestic cat living in your home, we might be able to medicate her with eye drops. But Bagheera wasn't very fond of us trying to put drops in her eyes, so we had to remove the eye. The good news is now she's pain-free. She recovered just great from surgery. She's negotiating her cage very well, and we're happy to say that she'll spend the remainder of her years here at Big Cat Rescue comfortable and happy.
You can help us change the way people treat big cats by texting TIGER to 20222.